We're going to be talking about Sage's phase 3 program of Sage 547 for super refractory status epilepticus. This is a IV infusion treatment, a GABA positive allosteric modulator that Sage Therapeutics is developing for a condition, super refractory status, where patients are in seizure for hours to days, weeks, and months. It's a very severe form of seizure. It's a life-threatening condition. A third of the patients may never recover. A third of the patients have ongoing severe neurological impairment. About a third of the patients will recover. And even patients who have very long episodes of status epilepticus may very well have reasonable chance of recovery. There are no approved treatments for super refractory status. Our program, phase 3 program, would, if approved, be the first treatment specifically developed for super refractory status. Sage 547 is a GABA positive allosteric modulator. We've shown activity as a GABA modulator in numerous status-related animal models, as well as in an open-label phase 1/2 clinical trial. So we intend to demonstrate efficacy in our ongoing phase 3 placebo-controlled trial. As this is a continuous IV compound, so this is given specifically in the intensive care unit in patients that are already in a chemically induced coma. So these are some of the most severely ill patients in the hospital. Because the drug has a short half-life, it can be given and needs to be given as a continuous infusion. Works very well with ongoing treatments, the other anti-epileptics, and potentially as well as the general anesthetics that the patients are receiving. In the clinical trial, patients are treated for up to 6 days, and then they're weaned off of Sage 547 as well as their other general anesthesia medicines. And then we look to see whether or not they remain in status. The endpoint for the trial is patients being status-free for the 24 hours after all of the infusions have been stopped. It's a blinded trial, so there's not much to say about the phase 3. In the phase 1/2 trial, which was an open label trial, we saw about a 77% response rate. That is, 77% of the patients were able to be weaned off of the general anesthetics and then be weaned off of Sage 547. So typically for patients who have had these prolonged episodes of status epilepticus, many of them, if they haven't had epilepsy or a seizure disorder beforehand, will go on to unfortunately develop epilepsy. We didn't in the phase 1/2 trial do long-term follow-ups on these patients. That's something that's part of our registration program. Safety is measured clinically, so potentially through adverse events that may emerge or complications in their treatment. As we wean them off and look to see how patients recover, we can actually get a better sense of what their clinical condition is. In the phase 1/2 trial, we saw no serious adverse events that were related to the drug. For a trial like this, we do have an external safety monitoring committee who looks at all of the potential adverse events to make sure that to determine whether they are or not drug-related. This is a condition that's treated for the most part in the intensive care unit, and for, I would say, the majority of the patients in our early phase, in our first trial, in a specific neurological intensive care unit. So the treatment team consists of specialized nursing, intensive care unit attending, and a specialized neurologist. Now, that neurologist can be, for the most part, are epileptologists, and there are some cases where the intensive care physician is also an epileptologist, and that's a very unified treatment team. But yeah, this is very much a specialty area of treatment. As we understand the safety profile and so forth, we have a much better sense of which hospitals would need to be able to have immediate access to this treatment. For Sage, we're interested in this very severe form of seizure, but we also have other molecules in our pipeline that are looking at other aspects of seizure disorder. We have another compound that's in very early phase of clinical development. This is Sage 217. This is an oral molecule, one with a long half-life. The intent is to treat other kinds of seizure disorders, potentially orphan epilepsies or genetically determined epilepsies, in an outpatient setting. So similar pharmacology, but in a form that would allow for more chronic outpatient treatment. At Sage, we're very interested in neuroscience broadly, but seizure is the most important area for us. It's where we have the strongest evidence, both for Sage 547, our most advanced program, as well as for Sage 217, where we have a very deep base of understanding of activity of Sage 217 in animal models. So this is an area that we'll be continuing to explore over the next several years, and hopefully we'll have news to report on the outcomes of those trials as well.